Hello everyone, now I'm going to show you how to set up your room for a pap smear. So before the patient comes in and you see on your computer that you have a pap smear coming up, what you want to do is grab a paper towel, set it up on your counter here, and head over to the table. And in the top drawer of the table, what you'll find is the majority of the things that you're going to need for a pap smear. You have this black and white swab, which is for a vaginal swab. And you have the pink swab, which is for chlamydia and gonorrhea. So depending on what you're doing, you might not use either, or you might use one or the other. Set those up, the side there. You have your specimen container, and I like to just open it up just before starting, but obviously closing it. Cytology brush. And this white part comes off, so once you take a sample, actually open up the container and pop the white part in. Okay. In the second tray, you have the different speculums, okay? And so once you get that all set up, you check to see if your light is working. In this room, the light switch is on the top. In other rooms, it might be on the bottom. It's working great. Pull out the syrups, set them up. And if you'll follow me, I'm going to grab a Clinigaid. And if you come to this desk here, you'll see one of our lovely Clinigaids. And you can ask them to help you out with any of the pap smears. Okay. So when your patient, just before your patient's in the room, you can pull out a gown, which is in the second drawer, as well as a sheet in the bottom drawer, and you can set them up on the bed. And when they come in, you can have them sit at the table, and you can step out while they change. So after you're done with your pap smear, to dispose of your used speculum, under every sink, you'll have a basin, and so you just drop the used speculum in there.
Okay, so once you have performed your test, so whether it's a pap smear, vaginal swab, CNS, or what have you, you just want to print the requisitions. So for a pap smear, how you order them is going through eForms first. You click the plus sign, and then just search for pap, and there is a specific pap requisition, Life Labs 2014 version. You just click on that. For the most part, this form you have to print it out and just fill up these boxes on a printed form, and then you attach it to the sample and send it over. For vaginal swabs, it's a different form. It's your Ontario Lab requisition forms from LabRec under Forms. And I'm just going to enlarge this for a second. So there is right here is a vaginal swab. So typically that would test for things like trichomonas, bacterial vaginosis, or candida. If you need chlamydia or gonorrhea, you specifically click on chlamydia, gonorrhea, and then list that the sample is a vaginal swab. And that is about it. For all the samples, you need to print out patient labels to attach it to the sample. And how you get that is you click on the patient's name on top of their chart. This window opens up, and you have a small button at the bottom here with PDF label. You just click on PDF label, the file opens up, and you just print it. And I'm just going to print it here. And you want to choose the Hall label printers as opposed to your regular room printer to actually print the label to attach to the sample.
So once you're finished with the pap smear and you've already printed off your labels, you put the label on the actual specimen. You walk it down over here. Each of these hallways has a midway, or roughly a midway, sort of meeting point where there's a station where you can drop off the samples. In this hallway, it's right here, So you grab a baggie, you put your labeled specimen in the bag, and there's a little pocket here at the side of the bag that you put the requisition in. Once that's done, you put it in the specimen container, just labeled specimens. Also, alternatively, there is a specimen container by the clinic aid desk.